Tonight I'm going to educate you. We are very nutritionally depleted, we're very toxic, and our bodies can only handle so much environmental pollution before it starts to break down. So let's talk a little bit about what doctors are seeing across the country right now.
See so much in terms of chronic disease nowadays, especially diabetes, hypertension, cardiovascular disease, tied in with the weight issues that America is facing. I mean, we're in a huge health crisis, and a lot of it has to do with most of America dealing with being overweight or even obese. And now we have 18 million children in this country that are obese, and they're also facing some serious health issues. The number of hospitalizations that people require, all the missed days of work, the number of office visits that people require to have their doctors take care of them. And you know, my office practice is booming, but it's actually quite sad to see so much illness and disease out there.
I'm going to take a look at the left, the middle, and I'll be able to see your surgical site inside. I'll probably take some pictures. If I see anything abnormal, I'll take some biopsies.
This is a huge crisis in this country, and it's so sad that our children need to see rheumatologists, infectious disease specialists, endocrinologists, pulmonologists, cardiologists, GI specialists. It's not like years ago when the kids went to see the family practitioner. Kids are sick. We're in a pediatric crisis, and they need these subspecialists to care for them. Why is this happening? Well, there's undeniable evidence out there linking toxins, chemicals, poisons to disease and illness. And so you don't have to take my word for it. You can do the due diligence that I've done and do your research, and you will find loads and loads of information out there absolutely documenting what I'm going to talk about this evening.
When I went to medical school, it was 1 year of learning pharmacy. I mean, learning the drugs, learning their side effects, how to prescribe them, when to prescribe them. And so last year in this country, 2.8 billion prescriptions were prescribed by health professionals. I mean, that's a staggering amount. And on average, when an adult patient walks into my office, they can be on anywhere from 5 to 11 pharmaceuticals. But a lot of drugs out there will cover up the symptoms. A lot of physicians will sit with the patient and describe a good nutritional system or a good nutritional program to, prevent them from going on a medication. And I tend to do the opposite. I will sit with the patient and say, let's talk about nutrition. When patients come in, it's very easy to address the issue of weight because about 81% of America is dealing with weight issues. And I tend not to shy away from that. I mean, people come in and say, I have reflux, or I have all these intestinal issues, or I can't stand it, my insulin requirements are so high, or my blood pressure medications, now I have 3 instead of 2, and I'll talk to them, have you thought about the issue with your weight? And especially the young ones, it's like, we need to address this now. You've got a long life ahead of you, and it should be a long life without doctors and without hospitals and pharmaceuticals. So I'm very open with my patients, and actually they're very receptive. I usually don't have people that get upset with this type of discussion. I think they're waiting for a health professional to sit down and potentially just get in their face and say, let's talk about the issues at hand. We need to get that weight off so we can take your health to the next level so you can have a better quality of life. For 11 years, and I've just watched my patients that I've taken care of for years watch their health decline. You open the newspaper and they talk about different toxins in the environment, different toxins in our food, in the air, in the water, and what our bodies are being exposed to. Some people really take it to heart, and they really try to be aware of these things and to do things to address issues of cleansing the body or eating, as healthy as possible. But a lot of people choose to ignore it. I think there is a great deal of denial out there where people just say, you know what, it's either not going to happen to me, or if it does, it was just meant to be. And people choose not to really take charge of their health or the issues at hand. So, in my professional opinion, I really feel that most disease and illness in this country is directly related to environmental toxicity, not genetics. I mean, there's a lot of genetic issues out there, but if you do have a genetic history, and that is also very important, but put that on top of environmental toxicity and what it does to your body. I mean, a lot of people are facing some huge health issues right now.
Toxins have been linked to cancer in all forms: breast cancer, lung cancer, stomach cancer, osteosarcomas, lymphomas, leukemias. Toxins have been linked to autoimmune diseases, lupus, fibromyalgia. I didn't even see fibromyalgia 11 years ago. I see it all the time now. Toxins are linked to weakened immune systems, neurologic diseases, cardiovascular diseases, pulmonary diseases, infertility, birth defects. I mean, toxins are linked to so many bad diseases and illnesses. We're not talking about genetics anymore. We're talking about the environment. I mean, that says a lot. These are poisons. They're affecting our body. Now let's talk about what toxins are. I mean, in my practice, I see a lot of irritable bowel, gas, bloating, the abdominal distension, feel uncomfortable, constipation one day, diarrhea the next, don't feel well after you eat something as simple as a salad. Look what goes into our bodies. Preservatives, pesticides, insecticides. On average in this country, 72 insecticides and pesticides on our fruits and vegetables. Pesticides are part of the food chain. We are ingesting them regularly. What do you think that does to our insides? Think about the water that we're exposed to. Our drinking water, polluted with heavy metals, parasites, bacteria, and you may drink filtered water, but you may not bathe in filtered water. Remember, your skin is the largest organ of your body and very porous and absorbs toxins right through the pores, and they circulate through your vascular system, through your lymphatics, and deposit in your vital organs. What about the air we breathe? I mean, just think about all these things. Very common sense, but a lot of people choose to deny a lot of this. But think about just walking outside, breathing the air. What about all the hydrocarbons we take into our system? Hydrocarbons are from anything that burns. Car fumes, truck fumes, barbecue grills, fireplaces, cigarette smoke. Did you know that when you breathe in these hydrocarbons, it's been shown in a nationally recognized study from the University of Arizona that these hydrocarbons break down the protectant gene that protects women against breast cancer. What about what we do to our meats? Hormone injections, steroid injections, factory farming. The animals, we want them beefier. We want them to produce more milk. They get sick, we give them antibiotics, and then we give them more. And last year in this country, 20 million pounds of antibiotics were given to our animals. And our animals have weird infections like mycobacterium and paratuberculosis. And we see all this antibiotic resistance in the hospital now. And then they say, eat fish because it's good for you. And the fish has mercury in it. And mercury causes all kinds of problems in the body. Look at our soils in this country. So many of our soil bases across the country have been over-farmed, and you're not repleting them with all the good nutrients and the microbes. So what's happening is our foods are nutritionally bankrupt. We become nutritionally bankrupt. Our foods need to be fortified. Ever go to the grocery store and notice how everything is fortified? The foods are dead. You have to give them nutrition nowadays. And when fruits and vegetables grow from soils that are depleted, they only have 40% of their nutrient value that they did in the 1940s, when the grounds were more repleted with all the good nutrients that we need. See, just think about what happens to our immune system, what happens to our bodies when we don't get the good nutrients. And then on top of it, pour all the toxins into our system. It makes so much sense to me why doctors are seeing so much illness and disease in this country. An old proverb says, a man digs his own grave with a knife and a fork. Well, look what's happening to us. Last year, USA Today in September released statistics that were staggering. 81% of our population is overweight, 31% meet the criteria for obesity, but the sad statistic is that 18 million children in this country are obese. Obesity, type 2 diabetes. 90% of diabetes is type 2 in this country, lifestyle disease, 18 million people with diabetes. Did you know there are children out there being diagnosed with type 2 diabetes at age 4 and 5? There are so many teenagers on insulin. See, diabetes doesn't wait till adulthood. Diabetes is a bad disease. I see it in the office every day. I see it in the hospital every day. Diabetes breaks down your vascular system. You may go blind. You may end up on dialysis. You may lose a limb. Well, why in this country do we gain weight? There's so many reasons. We eat too much. We eat the wrong foods. We don't exercise enough. We're stressed to the max. But why is that last point on that slide so important? It's something that a lot of people don't understand. What do chemicals and toxins have to do with gaining weight? Did you know that when toxins enter our body's natural mechanism is to produce fat cells? That's a protectant mechanism our body goes through.
Every year when certain patients would come in to the office, they were either gaining more weight or they had more illness, in their life, and they had more medications to tell me about and more doctors they were seeing and all these hospitalizations they had since the last time they came to visit. And it's hard for me to continue to prescribe more meds and more meds and more meds. So I started to look into nutrition and nutritional supplementation and exercise as options for my patients to try to get their